Case Study 2-1, Displaced Fracture of the Femoral Neck. While walking home from the trade station, M.A., a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. M.A. was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Intraoperatively, she was given spinal anesthesia and positioned on an operating room table, with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip and abduction, blood and fluid replacement, physical therapy, and vigilance for development of a vascular necrosis and possible dislocation. Case Study 2-2, Intertrochanteric fracture. A.R., age 88, slipped on the wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. A.R. had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiographs showed a non-displaced right intertrochanteric fracture. Intraoperatively, Mr. R. was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with a compression screw and side plate with screws. His postoperative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. Case study questions for number 1, replacement of half of the joint component. I wrote hemiarthroplasty. Number 2, substances that act against microorganisms, antibiotics. 3, in a position away from the midline of the body, abduction, abduction. And 4, position toward the midline of the body, adduction, adduction. Identify and define the prefixes in the following words. 5, displace and dislocate. Dis, and the meaning is apart or away from, reverse. 6, replacement and rehabilitation is back again, or contrary. Avascular, number 7, is A, without or lack of. 8, anesthesia and analgesic is an, which is without or lack of. Number 9, orthopedic is ortho, which means straight or normal. 10, externally is ex, which means upon, on, outside, on, outer side, outer layer, or protrude or outside. 11, bipolar is bi, which means two, twice, or double. 12, unremarkable is un, and it means not. For the fill in the blank, number 13, the adjective for the operative time span from decision for surgery to placement on the operating room table is preoperative. 14, the adjective for the operative time span from placement on the operating room table until transfer to post-anesthesia recovery unit or intensive care unit is intraoperative. And 15, the adjective for the operative time span from admission to post-anesthesia is postoperative. And that's everything.